In Parkinson's, there is a loss of dopamine in the substantia nigra pars compacta, which indirectly and directly causes numerous malfunctions such as nigrostriatal denervation and subthalamic hyperactivity, which all eventually lead to the thalamus receiving the incorrect information.
Parkinson's is an incurable progressive disease that affects your brain and eventually your body movement. It can affect people of all ages, but it is more common in older people, with the average age of onset to be in the late 50s.
Parkinson's is caused by a breakdown of the chemical dopamine in the pathways that lead to the thalamus. This is the part of your brain that interprets a signal that controls movement.
The chemical of dopamine in this situation acts like a carrier pigeon for the brain as it transports messages from one part of the brain to another, informing vital parts of the brain how to control particular movements of the body.
The loss of dopamine occurs on the pathways between the substantia nigra pars compacta. These pathways will not deliver correct messages to the striatum if they do not contain the right chemicals to allow the messages to move freely. This in turn causes the D1 and D2 pathways to create incorrect messages because there is less dopamine.
These pathways lead to the thalamus, and this is where the messages are processed and then sent out to the rest of the body. These incorrect signals are sent to the thalamus and interpreted, therefore sending out the incorrect messages to the rest of the body, which causes the visible symptoms of Parkinson's.
We don't know. It is suspected that unlimited environmental factors, including social norms such as drinking and hereditary factors, may be the cause, because they tend to cause loss of dopamine, but there is not enough evidence to prove this.
Because there are fewer nerve cells in their brain, there is less dopamine produced, and this causes changes in the body system, including the four most common signs of Parkinsonism, which are bradykinesia, tremors, muscular rigidity, and postular instability.
Bradykinesia is simply the slowing of the execution of movement. This is because the patient has trouble with the initiation and repetition of movements, especially fine motor skills like fastening a button. Another issue with this is akinesia, which is the lack of anticipated movement. So for example, when a person with Parkinson's attempts to lift the book, they can't.
The most recognisable sign of Parkinson's are tremors, which occur during muscular inactivity. These involuntary shaking movements occur mostly in the hands and feet. However, it can also arise in the tongue or one side of the body. Muscle rigidity is when the muscles are tense or contracted when they are not required to be, because the correct messages from the nervous system and brain are not being received. The spines of patients tend to lean forward due to the increased contracting of muscles in the upper back, causing a distinctive stooped appearance. Parkinsonism can have a negative effect on almost all systems in the body, including the autonomic nervous system. Because of this, many patients tend to develop emotional changes, dementia, depression, insomnia, and the absence of facial expression, commonly called the mask of Parkinson.